Okay. All right. Well, welcome everybody to the iConquerMS COVID-19 research study webinar. And thank you so much for joining us. It's delightful to be able to have a chance to share with you some information about the study that we've put onto iConquerMS in partnership with Farah Mateen from Mass General Hospital. It feels a little funny to start a call like this without going around and checking in and seeing how everyone's doing. But please reach out if you'd like to have a conversation. Let us know how you're doing, especially in light of the pandemic. If you need any support, if you just want a listening ear, I know there's a lot going on for everybody. So we're here to listen and be part of that conversation. So just to kick it off and get started, maybe. There we go. So here's some things about what we'll cover. We're just going to do a brief welcome. We'll give a few words about iConquerMS for those of you who aren't familiar with our people-powered research network. Just want to give you some background on that. Then we'll dig a little bit deeper into the iConquerMS COVID-19 study, why we initiated it, and what's included in it, and also what we see as the pathway to impact. We have quite a few collaborations to talk about, and definitely some pathways for dissemination. And we'll finish up our presentation with a slide on how to participate and share the conversation with your communities. And then we'll take your questions, and we're really looking forward to opening up and having a dialogue. If you have questions along the way, one thing I might suggest is that you put them in the chat box. And we'll take them as they come when we get to the question and answer period. So I thought, even though you can see us all on video, thought it might be nice to have some photos of everybody so you'll know who's presenting today. So here's Robert McBurney. He's the Chief Research Officer of Accelerated Cure Project, and also the co-principal investigator of iConquerMS. And many of you, if not all of you, will know his co-PI, Laura Koloskowski. We have Farah Mateen from MGH, and she's going to be talking a little bit about the survey and her interest in gathering this data from people living with MS. We have Holly Schmidt, who's our VP of Scientific Operations at Accelerated Cure Project and co-chair of the iConquerMS Research Committee. And then we have me, Sarah, who is the CEO of Accelerated Cure Project and co-chair of iConquerMS Engagement Committee. So moving on. So iConquerMS, here's a little bit about our people-powered research network. You might know some of these folks who are showing up over here, some friendly faces. But there is a spot for you if you're not a member of iConquerMS. So I hope you'll be inspired to join. iConquerMS is it's an online research initiative. As we said, it's a people-powered research network. And what we're focused on is patient-centered, participant-centered, participant-powered research. So we have, actually, even today, the numbers just keeps growing, close to 5,700 registered participants who have consented to participate in this research initiative from the comfort of their own home. It's an online community, an online way of contributing to research. So you just go to iConquerMS.org, you register and consent, and then you have the opportunity to be part of this new way of driving and shaping research. It's participant powered. We're gathering not only data and ultimately biospecimens from people affected by MS, but also insights and expertise. It's participant governed. The initiative was designed with the patient community involved, and it also has a very robust governance structure, including a governing board, an engagement committee, and a research committee. And each committee and the board are all populated with the majority of people living with MS. Everything that gets done in the initiative goes through these entities to ensure that it has the commitment and the insights and the stamp of approval of the patient community. And it's participant-centered. We're really focused on accelerating research and innovation that are really aligned with the priorities and needs of those affected by MS. It's an inclusive research initiative. Anyone can participate. whether you're living with MS, a care partner, or just have a general interest in research, in MS research. But also we're very focused on ensuring that the population is richly diverse in a variety of dimensions, including age, ethnicity, ability, subtype, etc. So I'm going to turn this over to Holly and Farah to talk a bit about the COVID-19 study and why we have populated the study on iConquerMS.
All right. So I guess I'll start, Holly, and then you can just add in as you see fit. So first of all, nice to meet new friends and old friends as well. And just to introduce a little bit about myself and how I got involved, I'm a neurologist and I'm a subspecialist in MS, and I work at Massachusetts General Hospital. And I also have a PhD in public health and epidemiology. And sometimes those are intersecting and sometimes they don't. But in this particular instance, public health and MS have a critical intersection. And this is patient driven, this question. So a lot of my own patients started asking about coronavirus early on. And we started getting a lot of questions and concerns. And then we started talking amongst ourselves, and I thought, well, why don't we do this more systematically? Why don't we try to understand the MS community's perspectives? And coronavirus has not only taken over the world, but it's profoundly impacted people with MS. And so even, of course, among people who may never be exposed to the virus, the impact on their life has been substantial. So this sort of people-powered network is the ideal situation to understand what we consider the knowledge, attitudes, and practices are among people living with MS in the pandemic for COVID-19. So those are the themes. It's not a quiz about what someone knows. It's really getting a sense of people's experiences and what they've experienced in terms of their lifestyle and how they may have changed things, how they may have changed their medical experience, and so forth. So the survey development was basically questions that had come up in my practice. We're linking very closely with existing knowledge and among existing participants. So this is open to new participants if they wish, but also open to people who are already part of the platform. And this was, I think, an iterative process with the group, with Holly, with Sarah, with Robert, and also just trying to get a sense as the study evolved what patients were asking. We are in the process of doing the survey, which I'm sure Holly can tell you the most about, and we're continuing to enroll right now. So our goal is to get as many people as possible to provide a really comprehensive understanding of what's going on. And of course, you don't have to have been exposed or have the virus. This is for everybody with MS to understand what your experience has been. And the goal is to, once we have the information, to disseminate that back to the MS community, both the patients as a priority, but also to providers who may not have a sense of, of all the range of experiences that patients are having. And then also to the academic world, so that we can have MS have a voice in academic neurology and medical journals. I think the power is the numbers. And so knowing what so many people, what their experiences are, I think that'll be a really important and hopefully impactful paper for the MS community.
Great, thank you, Sarah. So I'll fill in a few more of the details. We also at ACP and iConquerMS have been hearing questions from our community members about what they should be doing, also hearing or finding out about some questions that healthcare providers were having. So we thought we could help answer some of these questions by surveying people with MS, which is our community, about their experiences. And then Farah approached us. She was developing her own survey, and it was very serendipitous that we were developing one, she was developing one, and they really, meshed very well together. So as Farah said, we pulled all the questions together and sorted them out and figured out the best way to ask them and implemented them on the iConquerMS platform. Just a few more details about what we're asking about in the survey. We'd like to know people's personal experience with COVID-19, have they been exposed? Have they had any symptoms? Have they gotten tested? And, getting tested has not been an easy process or a widespread process here in the US. So we'd like to know if people are, feeling like they could be tested but haven't been. If they've been diagnosed with COVID-19, have they gotten treated? And then also, how are they avoiding exposure and what's their level of concern about the virus? We're also asking about healthcare changes due to COVID-19. Have they wanted to change their disease-modifying therapies? Have they actually made any changes to them? If so, was that in conjunction with their healthcare provider? Have they had any difficulties or delays getting healthcare? Have they done any telemedicine to avoid a face-to-face visit where it might not have been needed? And then also, are they uncomfortable or comfortable doing things like going to the hospital if they feel sick, or going to the clinic for an infusion, or things like that? So we're really trying to get a sense of how people are viewing healthcare in this time of COVID-19. We're also very interested in effects on people's quality of life. And I'm sure everybody knows that COVID-19 has really disrupted a lot for a lot of people, including employment. So we're asking, has COVID-19 had an effect on their employment, but also things like their finances, if they've had a change in their ability to get the foods that they normally eat, and any impact on their ability to exercise, because these are all really important factors in a person's daily lifestyle. And then also we ask about the typical things, what type of MS do you have, what's your date of birth, and where do you live, and things like that, to sort of help us analyze the data once it's been collected. And then finally, we also ask a number of open-ended questions, because there's a lot that people are feeling and going through that maybe isn't captured by those specific questions and the specific choices that we have. So we want to make sure people have a chance to voice any other concerns or thoughts or ideas or questions that they have that should be taken into consideration when we look at the impact of COVID-19 on people with MS. So we also looked at surveys that were being hosted elsewhere. So there are a few, well, many at this point, but when we started, we were aware of a few different MS COVID-19 surveys, or COVID-19 surveys being developed for other diseases. And we wanted to see if we could harmonize what we were asking with what other groups were asking, so that down the line, if there's interest, we can compare our data. How does COVID-19 affect people with MS, and is that different from people with another autoimmune disease, for example, or people in one part of the world versus another part of the world? So we took care to do that as much as possible. We also kept an eye on the length and did some testing to make sure it was reasonable. Right now, it looks like it takes about 15 or 20 minutes to take. And then we got, finally, approval from our ethics board, which is very important. So they gave us the stamp of approval, and we launched 2 weeks ago. So Farah, I don't know if you had anything else you wanted to add before we hand it over to the next topic.
No, I think that detail was great. The only thing I would add is the hope is that this is useful for policy, or that this may actually impact hopefully there's never another experience like this again. But the hope is that also we understand the impact on people with MS, and that having numbers behind it and having data will actually help people with MS and different MS societies advocate for patients, just to show what is actually happening versus one anecdote or another, to give it the power of numbers.
Great. Thanks so much, Farah and Holly. I guess I'll mention one other thing, that all of the survey data that's being collected is done, as Holly mentioned, under IRB approval. It's passed an informed consent, so people do understand that it's a research process, and it's stored in a de-identified fashion. So folks can feel comfortable that their contact information is not stored in the same database that their survey answers are. Robert, I can turn it over to you to talk a little bit about some of the collaborations that we're working with.
Thanks very much, Sarah. We are not alone, and collaboration is one of the central missions and ways of moving things forward for the iConquerMS community. And so Holly mentioned that at the time we were thinking about a survey, we came together with Farah to develop the survey together, and that's great. But we were not alone. At the same time, a number of activities were beginning to take place globally and also in North America. And so there are two types of activities in surveying about COVID-19. One is the gaining of information from patients or patient-facing surveys. And the iConquerMS survey is a patient-facing survey. But in addition to that, a number of the initiatives are asking clinicians to provide data to various databases about what they're seeing with regard to people living with MS and the way of being diagnosed or not, but having symptoms, and also what's happening to them in their care and in their access to healthcare as well. So within that, there are lots of questions that are very similar between the patient-facing surveys and the clinician-facing surveys. And so, not surprisingly as well, because iConquerMS is well known both in America and worldwide, we were approached by a number of the initiatives to collaborate. And so, in addition to the collaboration between iConquerMS and the Massachusetts General Hospital in creating our survey, we are also part of a global initiative under the auspices of the Multiple Sclerosis International Federation, the Charcot Foundation, or the European Charcot Foundation as it's more formally known, and a new organization that was formed last year called the MS Data Alliance. And it's been so wonderful that that organization was in the process of being formed, because this was a perfect first project to do, to gain information and share it internationally. And so we are part of that initiative. We are one of a number of leading patient-facing surveys in that initiative, and the only survey that really is available worldwide from a patient-facing point of view. There are a number of clinician-facing surveys from different countries and different organizations that are part of that, and all of the data will be brought together in an anonymous fashion, as Sarah outlined, to really learn about what's happening, not just in individual countries, but also across the world. So that's a wonderful thing. And one of those clinician-facing registry initiatives is a North American COVID-19 initiative, which involves the National MS Society and a number of other societies and advocacy organizations in North America. And so they're the things that are happening, and certainly not an exhaustive list of things that are happening both locally and worldwide. But in addition to that, the iConquerMS People-Powered Research Network is a member of a newly formed autoimmune research collaborative that involves 4 people-powered research networks, one in arthritis, one in inflammatory bowel disease or Crohn's and colitis, and another one in vasculitis. And we've also become part of a group that where individual surveys have been launched there. And in fact, as Holly said, some of the questions in other surveys, even across the Autoimmune Research Collaborative, have been sort of unified. And so we'll be able to share findings as well across different autoimmune diseases, as well as across the different MS initiatives. And so that's what's really happening at the moment collaboratively, and it may even expand going forward. But it's a very exciting collaborative initiative that really fits squarely into the mission of iConquerMS and our collaborative principles. from a dissemination point of view, perhaps I'll let Holly and Farah talk about the two things that are identified on this slide. Over to you.
Thanks. So I'll just do a quick report on reports to the MS community. We do intend to take the data that we have been collecting and package it up so that we can share it back out with the people who participated in the survey as well as the wider MS community. We're looking forward to doing that. We have been partnering with the MS Coalition organizations, so all the organizations of other advocacy organizations. You can see some of the logos over to the right. They have been very helpful in helping us get word about the survey out to their constituents, and we're super grateful for that. And I think once we have reports about what we found, then we'll also ask for their help in letting people know that there's something available to look at and learn from. And Farah, do you want to talk about communications to the scientific and medical communities?
Sure, yeah. So we also have ethics board approval through Massachusetts General Hospital. So we're covered twice to synthesize and disseminate the data. So we want to create something that can be sort of peer reviewed. So really vetted through the academic community and published so that it has that sort of archival opportunity so that someday somebody can hopefully look back at this and also read it and understand the final analysis and the context in which it exists. So we want to make sure we've targeted other academics, people outside of the MS field who are starting to think about coronavirus and immunosuppression and coronavirus and living with with MS or anything that can impact your life. So we want to make sure that people have the opportunity to see the data forever if they want to. Potentially at academic MS meetings as well through, meetings are changing constantly. So they may be online, they may be in real. There are international and national MS meetings coming around the corner in the next year. And we want to make sure that as many people as possible have access to the information. And also a lot of students, residents, fellows come to these meetings and they get inspired to learn more about MS and become future MS neurologists. So we want to make sure people have access to what we learn.
Great. Thank you both. Well, thank you all three. So participating, we hope that you're interested and we'll share this with your community. It's really very straightforward to participate. If your community member is already a member of iConquerMS, all they have to do is log in and visit their dashboard and they'll see the COVID-19 survey right at the top of their available research surveys. If they're not a member, again, super straightforward, just visiting iConquerMS.org, clicking on Join Now. There's a little exchange of email addressing and you get an email with a link to complete your registration where you create a password, complete a short profile. And then right again, you're back at your dashboard and there's the COVID-19 survey. So we're hoping that you're excited about what you've heard about the reasons why the survey has been developed in response to questions that were coming from the MS community, and that the collaboration that we've done not only in development of the survey to enable future sharing, but also sharing the survey more broadly through other advocacy organizations and the plans for really robust dissemination, that all of those things make it sound like something you'd be interested in sharing with your followers. So thank you so much for listening to us and for hearing about this initiative and the study. And I'm going to stop sharing so I can check stop sharing my screen. Oh, looks like I can check the chat box anyway and see if perhaps we have any questions. Okay, so we do have a question about whether or not we have a target number of participants for this survey to make it meaningful. And so I'm going to turn this over to Farah to talk a little bit about the significance of the size of the cohort.
Yeah, so it's a great question. It's something we've discussed. So right now we have several hundred patients already in the study, but we would like several hundred more if possible. So there's, I think, not one set number, but we're trying to reach about 1,000 people as respondents. And I think we're about 700 to 750, somewhere in that zone, Holly?
Yeah, probably by now. I think it's about 7:15 when I checked earlier. So yeah.
Okay, I guess I was counting counting ahead of ourselves. But I would love to see 1,000 MS respondents if we can make it there. So I think that's a reachable goal, and if we get there, then I'll be ecstatic. And what that allows us to do in terms of analysis is to think about subgroups. So we can think about um, certain responses versus others. We can think about certain age groups, certain types of MS, other things that we wouldn't otherwise be able to do if we had a smaller number. So you get better representation, better diversity of the data, which is, really what we want. We want to be able to understand the data, not just as one group, but as it may impact certain groups differently. We want to be able to see those nuances. So 1,000 is a bit arbitrary, but I think that also would have a really good impact in the literature. I'm not aware of a similar study published on 1,000 people with MS in a particular setting like this. So I think we'd really be able to give a lot of data. So that's kind of the number. I think we could go with less, but I think that's the goal.
Great, thank you. And so we have another question. It's actually a two-part question. I'm going to combine them about how long will the survey be open and available, and whether or not we plan to do a follow-up survey in a few months. So Holly, do you want to speak to that?
Sure. Yes. So the survey will be available for the foreseeable future. We don't have a firm cutoff date. We do have a goal of downloading what data we have at the end of this month so that we can start working on a publication and get that out as soon as possible. But obviously, the situation where the virus is still in circulation and people are still going to be, their lifestyle will still be different than it was before. That will continue on into the future. So I think we'll be leaving the survey open for a while longer to let people come in who hadn't already come in and provide their data. And then we would like to do a follow-up survey, maybe 2-3 months in the future, so that people who originally filled out the survey can come back if something has changed, or even if something hasn't changed, come back and let us know what has taken place over the last, few months since they originally gave us their data. So if they originally said, I have not been exposed, but then after that they did get exposed, or if their employment was affected or something like that, they can come back in and let us know about that. And then we can do some interesting follow-up work about, how does a pandemic change its effect on a population over time, which is, very meaningful, in addition to just being able to say, what's it doing to this population at this present moment? So we're looking forward to being able to sort of show both sides of the situation for people with MS.
Great, thanks, Holly. So we have a question, can we use these slides on our blogs and programs? And yes, the answer is you're absolutely welcome to use whatever you'd like from this slide deck or this webinar as information. And if you need additional follow-up information, my contact information is there, sloud@acceleratedcure.org. Be happy to provide you with whatever you need for any blogs or social media content or what have you. We have another question. I think this one will go to Farah. Would 1,000 participants provide enough information to look at experience and response differences based on geography?
Yeah, I mean, that's a great question. So the right answer is it depends on where the participants are coming from, of course. So provided this is not population-based sampling, so we don't have X number of people coming from each state, for example, but as long as there is a large number, I think we can look at geography. And we can look at, for example, urban versus rural. We can look at East Coast versus West Coast, and the unit of analysis for the geography can change. It can be a more like granular unit if we have more people. So that'll be really, and we can even do, for example, age by geography or other things. For example, we've asked, as Holly mentioned, about employment, and maybe that's more profoundly important in highly urbanized centers? And we don't know yet, so so we'll be able to answer that. But I think in general, stratification of the data by any variable of interest will become more possible and more interesting and more important as we get more participants. So we hope for as many people as possible to answer the kind of what we call in medicine, like the first pass metabolism of questions is always the, what's happening at the overview, at the bird's eye level. But as we get more people, we can answer specific questions that we wouldn't have otherwise been able to answer. So that's why we're hoping more and more people will join.
There are 5,700 participants from every state, covering every state in the United States. One of the ways to get that data is for everyone from every state in the United States to participate in this survey. So maybe our goal should be 5,700 plus for the for the survey. But I think that the answer to the question is exactly as Farah said. The more people with diverse backgrounds, no matter what that is, who complete the survey, the more we'll be able to return data that's relevant to everyone in the iConquerMS community and beyond. So I think that this is a great opportunity to mobilize and complete the survey.
Yeah, well, I was going to say what we often find is after a survey is completed and we start looking at the data, is that there are additional questions that come out of the root. So things that we wouldn't have anticipated, or responses in a certain direction that we didn't even think would occur. And then that leads to new questions. And so we're able to answer those new questions that we couldn't have possibly thought of at the beginning, just because the pandemic is evolving so quickly. So again, the bigger the sample size, we can ask those subgroup questions that may have not even crossed our mind a few weeks ago when we were developing the survey. So I agree with that, Robert. The diversity and, the diversity of the pandemic has been so important in this country, and the diversity of health experiences and access to care. So we want everyone as much as possible to reflect that.
Well, that's great. You guys are giving excellent reasons why sharing this survey broadly to reach as many people as possible and encourage them to participate is so meaningful. And we did have a comment in the chat box saying thank you for doing the important survey, that the recognition that this will be useful to many different groups, but especially to people with MS. Just want to take a pause and see if there's any other questions that are coming to mind. Otherwise, we can just thank our presenters and everyone who's been involved so far in developing the survey and getting it out there, and to all of our respondents. We're grateful to you, and we're grateful to our future respondents as well. And so if anyone on this webinar is excited and willing to share this information about the survey, the study, please be in touch with me or Laura, and we can make it happen. And would thank you in advance for that. Great. Well, anyone have any final words?
I just had one more thought. I have a lot of colleagues in lower income countries, and I work in Africa as well. And I get a lot of questions about how are your patients doing, and how are people in the US doing? What are their approaches? And so I think this is also an opportunity for us in the US to help countries that may unfortunately come after us and get the virus and have their own epidemic experience. So maybe, we have an opportunity to use our experience to help other people who haven't gone through this yet. So I think of this as a way to help people we may never meet as well. So if people with MS here are willing to help, I think, you've got a kindred spirit somewhere you haven't met yet.
That's a great way to end, Farah. Thank you so much, because I know that will resonate with a lot of people who want to participate in research. So thank you, everybody. This has been great and informative, I hope, and we're looking forward to sharing more information with you, and also reporting back when the study is completed. Thanks, everyone.
Thank you.
Thank you.
Bye.
Bye.
Have a good evening. Bye.